What to expect from fibroid surgery? The first question you may ask yourself is that, do you really need the surgery? You may not need the surgery if the fibroid don't bother you. However, you might consider surgery if your fibroid do the followings to you. One, you have heavy menstrual bleeding. You have bleeding between your periods. We have pelvic pains. We have frequent urination, trouble emptying your bladder, or even trouble or having difficulty in getting pregnant. Surgery must also be an option if you want to get pregnant in the future. Therefore, it's very important that you get with your fertility specialist. Look at the fibroids, look at the growth of the fibroid, and look at the impact of the fibroid to you. It's better to have surgery for a small fibroid, which has less complication, than wait and have a big fibroid and do surgery in order to get pregnant. The bigger the fibroid, the bigger the distortion in your uterus. The bigger the fibroid, the bigger the distortion you'll have in the uterus, and the more difficult for you to get pregnant. Sometimes fibroid can increase your risk of having miscarriage or complication during pregnancy itself. Therefore, if you're pregnant with fibroid, you still have a risk actually during that pregnancy. If you decide to do surgery for fibroid, there are probably two options. One, it's really myomectomy, which is reserved conservatively really for people who'd like still to have children. Hysterectomy is the total removal of the fibroid with the uterus. In that case, you cannot expect to fall pregnant after doing hysterectomy for the fibroids. The type of fibroid surgery depends on the following: the size of your fibroid, the size of the fibroid, the number of the fibroids you have, the location of the fibroids, and fourthly, the desire for you to have children. Therefore, these are paramount important factors which you must put into play, or you must think about when you want to go and do surgery. That surgery of the fibroid depend on the size of your fibroid, the number of the fibroids you have, the location, where are they, and the desire for you to have children. Myomectomy is a procedure to remove the fibroids and then not removing the uterus in expectation so that you may be pregnant in future. About 80 to 90% of women who have myomectomy get relief from their symptoms. That may be heavy bleedings, that may be pain, and so forth. About 33% of women who have surgery for fibroid, unfortunately, will have a repeat surgery. Not that the first surgery was done badly, but because fibroids are recurrent. And this 33% will be within 5 years. Hysterectomy is removing the fibroid with the uterus. And hysteroscopy is removing the fibroids in the uterine cavity. These are two terms: hysterectomy, removing the fibroid with the uterus, and hysteroscopy is then removing the fibroids, which are probably growing in the uterine cavity, but leaving the uterus. A resectoscope is an instrument which is used to cut the fibroid to remove it so that it can give a space for you to be pregnant in the future. Abdominal myomectomy is done through a laparotomy with an up and down incision, or a fan and steel incision. And hospitalization is usually for 3 to 4 days after abdominal myomectomy, and recovery takes 2 to 6 weeks. Hysterectomy is removing the whole fibroid with the uterus. This procedure is indicated for a fibroid which usually is very large, and a person is not planning to be pregnant in the future, or the person have completed the family. The uterus may be removed in few ways. One, it may be through a laparotomy, abdominal hysterectomy. It can be removed vaginally. Vaginal hysterectomy. It may be removed laparoscopically, which is called laparoscopic hysterectomy or laparoscopic myomectomy. It can be removed as well by laparoscopic assisted vaginal hysterectomy. What is exactly endometrial ablation? Endometrial ablation, it's a non-surgery. It's considered a minimal invasive procedure. The procedure destroys the lining of the uterus. Endometrial ablation can be done in the doctor's office or in the hospital. Endometrial ablation is not indicated for a person who would like to have children. It can be used to treat a fibroid, but it shouldn't be used for a patient who still would like to have children, because basically you have burned the inside of the womb, which is called endometrium. In this part, that's where the baby implant, or where the embryo or the blastocyst implant. Now, because you have bent it, that part is difficult to grow it back. It needs a lot of estrogen, and it's risky. Therefore, endometrial ablation is not indicated for a person who'd like to have children. It may be minimally invasive, low risk, but is not indicated for a woman who still would love to have children. Method of endometrial ablation available is electrical current, which is used. It can be a balloon, heat balloon. It can be a high fluid energy radiation into waves into the uterus, or radio frequency. It can use a cold probe as well, or microwave energy, or heated fluid. All these, they are destroying the endometrium, which is the inside of your uterus. And that uterus will be having difficulty to conceive. Endometrial ablation is effective for relieving bleeding from usually small fibroids. Risk associated with fibroid surgery. Any surgery has got complication and risk associated. A good planning, however, lower the risk or minimize the complications, like bleeding, infection, need for repeat surgery again, damage to organ which may be surrounding that fibroid, the bladder, anterior, posterior, it may be the bowel, on the lateral side, it may be the ureters. Therefore, it's very important that a meticulous planning is done for the surgery. Complication may as well be scar formation, bowel and urinary problems post-surgery, fertility issues, pregnancy complications as well, and even a rare chronic, a rare situation whereby hysterectomy can be done. I would like here to put a word of caution, because a lot of patients encounter a situation whereby they are diagnosed with a fibroid, and the doctor say, I cannot remove this fibroid until you sign a consent that if you bleed, I should do hysterectomy. I said hysterectomy should be a rare complication of myomectomy. Therefore, it's very important that is clear. Therefore, a fibroid is not an indication for hysterectomy. Surgery for fertility is called myomectomy, because in this surgery we preserve fertility and we only remove the fibroids. Then surgery not for fertility, it's uterine ablation, which I talked about, and it's uterine artery embolization. Therefore, they may be minimally invasive, but these procedures are not for patients who'd like to be pregnant. There is no controversial issue about uterine artery embolization, but the studies are still very few which indicate that it should be used for patients who still need to have children. Medical treatment for fibroids, it can be non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, and so forth. Birth control pills as well can be used. Anti-hormone drugs like progestin or danazol blocking the estrogen receptors and, refusing or making sure that fibroid doesn't have estrogen, because, the fibroid to grow need estrogen. Gonadotrophin releasing hormone agonists like lupron or Cinara, and tranexamic acid like Listeda may be used, which is all medical treatment for fibroid. But this medical treatment for fibroid is not to assist a person with fibroid who need to be pregnant. It's only a temporary treatment to prevent certain symptoms, not necessary to assist for the person to be pregnant. Non-invasive procedure for fibroids. MRI-guided focused ultrasound surgery uses sound waves guided by MRI scan to hit and destroy the fibroids. The second non-invasive procedure, it may be uterine artery embolization, which, pellets are thrown in the uterine artery and then blockage so that there is no blood supply to the fibroid and the fibroid can die of ischemia. It's like giving a fibroid a heart attack, some sort of. The other procedure which is new is called myolysis, such as accessor procedure, use electrical current and hit and destroy the fibroid. And cryomyolysis is the other option which can use, is actually using the opposite. Rather than the heat, then you're using freezing, and then you freeze the fibroid, then the fibroid die off. It's very important, I want to stress this point as we discuss about the fibroids, because fibroids are very common, and fibroids can cause you to have difficulty in getting pregnant. There are procedures which are used, which are conservative, whereby you can remove the fibroids and we can keep your uterus so that you can be able to conceive in the future. Thank you.